Hello friends, this is Dr. Akshita Shanbag. So today we will discuss two drugs from the lectures on homeopathic Matra Medica by J.T.Kent, and I have given the name J.T.Kent Keynotes because most of the students don't read this book thinking that it has many pages for each drug and it's difficult to remember, but these are the symptoms where it helps you clinically a lot. So in a patient what you have to see, Kent tells you that, so it's important to read this book. So I'm trying to simplify it by giving the name JT Kent Keynotes. So beginning with Abrotanum, which is the first drug you get in the lectures. So Abrotanum is a drug prepared from plant, and the first symptom he gives is marasmus. Marasmus is losing of flesh. So there is weakness, and the weakness will be from below upwards, that is from lower limbs upwards. He even gives the remedies which are having opposite symptoms, like if the symptoms are running from upwards down, then the remedies will be lycopodium, natramur and sorinum, he says. Then comes the chest pain. He explains about the chest pain, which is especially from pleurisy, which is given after bryonia. So Abrotanum will help in chest pain from pleurisy after bryonia has helped. Then comes metastasis. It is a good drug for metastasis of symptoms. Now here metastasis is not cancerous metastasis. Metastasis in general we have to understand. So that is running from one side to other side. So here he gives the symptom inflammation of parotids, that is the mumps. If a person has got mumps and it has been cured, it gets shifted to the testis or the mammary is the breast. So this remedy will help in such metastasis. There is another drug also, that is carboveg and pulsatilla, which also has which will also help the inflammation to run from parotid to the testis or mammary. Then comes suppression, one of the best drug for suppressions. Here suppression in the sense, if there is a suppressed diarrhea. So if a person is suffering from diarrhea and he was given some medicines for diarrhea and it got suppressed, after suppression the diarrhea will be better, but he will suffer with piles or acute rheumatism. So if you asked in the past history to an Abrotanum patient who has come to you for rheumatism or piles, he will give you history of diarrhea. He used to have frequent diarrhea and he was being given medicines for it, and the diarrhea was stopped, but he came up with rheumatism or the piles. Then Abrotanum will have the role in that patient. Then he gives even general symptoms, like the Abrotanum patient is very sensitive to cold air and cold damp weather, and it also has backaches which are aggravated during the night, and hydrocele in boys is also cured by Abrotanum. And also he says if there is a bleeding from the navel in infants, Abrotanum is helpful. So the next drug we will be studying is acetic acidum, which is the second drug in the Kent lectures. So acetic acid is nothing but vinegar. Now vinegar, you know, the which we use in the kitchen and all. So so it's one of the best remedy for chronic diarrhea he gives. So chronic diarrhea but has great relief. That means what? So now here patient is suffering from diarrhea, but he is happy with that diarrhea because he feels better if he is having diarrhea. So the other remedies are natrum sulph and zincum met. So whenever he has constipation, it will always be with bleeding and with rheumatism he gives. Then there are some general symptoms he gives regarding acetic acid. That is, there will be the person will be very pale, sickly people. They will have symptoms of inherited phthisis. Symptoms of inherited phthisis in the sense tuberculosis. So it is not necessary to have tubercular infection only, but tubercular infected symptoms what will be there, like emaciation, weakness, loss of appetite, burning thirst, copious pale urine. then dry hacking cough, and night sweats. These will be found even in the patient of acetic acid in with diarrhea or with diabetes. If even if he is not having tuberculosis, these symptoms are present generally, he says. Then comes the sensation of heat with pulsations coming and going will be present in this drug. Then sharp pains which will be present here and there, and dropsical conditions in the sense there will be swellings, accumulation of fluid will be present here and there in the acetic acid, one of the very good remedies for dropsy. Then bleeding from various mucous membranes. Wherever there is a mucous membrane, like if it is from the rectum or from the nose or from the throat, so it can be anywhere, there will be bleeding from the various mucous membranes. So mind symptoms, you can find confusion of mind, he says, in acetic acid. Confusion of mind so much that he does not know her own children. That much of confusion you find in acetic acid. And he is forgetful for recent happenings. Whatever recently the events have happened, he forgets those things. Very peevish and complaining. Very angry person, irritable and complaining. And the next point he gives is the acetic acid will always have fainting spells, in the sense frequently they will be having this fainting episodes. So, and one cheek pale and the other red. And he also has unquenchable thirst means he is having very increased thirst, very much thirsty person. Then there will be burning in the stomach and abdomen, which is ameliorated by lying on the stomach. Acetic acid, this is one of the main symptom you find, where there is a burning in the stomach and abdomen, which is better only when he lies on the abdomen. Okay, so, and relaxed genitals in the males with swollen feet. He has a relaxed genitals with swollen feet, he gives. Dropsical affections you find everywhere, wherever the symptoms are present. So these are the symptoms of the acetic acid. And also he gives laryngeal diphtheria with hoarseness. It is one of the good drugs he gives. And in extremities there is weak lame swelling with diarrhea. And he says that acetic acid is one of the deep constitutional remedy, so it can be prescribed as a constitutional remedy. So lastly he mentions in Kent lectures, all substances which are abused as food becomes great remedies, such as vinegar, coffee, common salt, etc. We should look to them oftener than we do for the stubborn chronic cases. This is what he says. So everything we see, we feel, everything can be prescribed as a homeopathic remedy, but if it has been prepared properly. So I hope it has helped you to understand the two drugs. Thank you.